welcome everyone today to our program on osteoporosis. We are from Women's Health and Family Services in Perth, but I'm serving all of Western Australia. And to my left, I have Janet Pages-Oliver, who is a registered nurse and midwife at Women's Health and Family Services and works in the Rural InReach program as well as the clinic. And to her left is Christy Law, who is our dietitian, who works in the community development program and runs the nutrition program. We also have a talk on menopause that is available on our website at Rural InReach. So if you are looking for more information on menopause, feel free to look at that talk via YouTube. And so Janet, today we're talking about osteoporosis. So what is actually osteoporosis?
Osteoporosis is a condition where the bones become very fragile and brittle, and that's because the bone itself seems to go very thin and porous. And you can see there on the slide, there's a photo of bone, and what you're looking at there is the huge gaps that are actually existing between the actual bone cells. So that is an osteoporotic bone.
Okay, and Christy, I've been very intrigued with this model that you guys have brought this morning, and this is sort of one of a normal bone and osteoporosis bone. So can you explain a bit more about that?
Yep, sure. So the normal bone, as you can see on our left side, is quite dense, and there's lots of connections, and the walls, I guess the walls inside the bone are quite thick, which means that the bone is quite strong. Where on the other side, you've got an osteoporotic bone. So as Janet said before, there's a lot of gaps in there and quite thin connections, meaning that the bone is a lot weaker, which then basically what that is, it increases the risk of fractures with falls.
Okay, and Janet, I mean, obviously falls aren't pleasant at the best of times, but it's much more serious than that if someone has osteoporosis and they fall. So can you explain a bit more about that?
Sure. You're much more likely to incur a fracture if you have osteoporosis and you sustain an injury of some sort. And what we found is that with a hip fracture in particular, there is early mortality. So a lot of people will find that they won't recover from a hip fracture. And also the other thing is 50% of people with hip fractures require huge amounts of rehabilitation and care. So then that places a huge burden on facilities and resources to rehabilitate and to ensure those people do make a healthy recovery.
So why is it that people have such a high death rate from a fall, from a hip fracture? I mean, it's not like they're having in a car accident. You could understand people dying. So what happens there?
Yeah, well, usually that's around people being immobile for extremely long periods of time. And when you have a fracture, there's a huge amount of bleeding that goes on from the bones themselves. So there's pooling of blood, which can lead to formation of clots, which then can certainly lead on to more serious problems happening, such as strokes, cardiac attack, and different things like that.
Okay, well, that's really interesting. And so is it very common, osteoporosis?
It unfortunately is becoming a lot more common. Up to 1 in 2 women and 1 in 3 men will develop osteoporosis or become or have an osteoporotic fracture in their lifetime. So that's really high odds. When you consider that 1 in 8 women will present with a breast cancer in their life, knowing that 1 in 2 women will present with an osteoporotic fracture is pretty scary odds.
Yeah, very high.
At the moment in Australia too, there's about 2.2 million people who suffer from osteoporosis, and in another 8 years' time, they're estimating there will be 3 million people. So it's increasing all the time.
So obviously, those are very scary figures. And so, Christy, are some people at higher risk of getting osteoporosis?
Yeah, yes, there is certainly risk factors, such as just naturally aging. So as we age, our risk for osteoporosis does go up. Those with a Caucasian or Asian background tend to have a high association with a greater risk of osteoporosis. For those who are underweight or females who experience delayed onset of menstrual period or interrupted periods, for example. Female athletes, sometimes the onset of puberty is quite late. They can be at a higher risk of osteoporosis, and purely because estrogen has been shown to have a protective effect with helping to build bone density. Other things like just, if you've already had a fracture, that does as well increase your risk for osteoporosis.
Yeah, and I've heard that the more unhealthy lifestyle factors can also increase people's risk of osteoporosis. So what sort of things are they?
Yes, yeah. Well, it is, it's in line with as well with those risk factors, lifestyle factors that increase our risk for other chronic diseases such as diabetes. So just a lack of exercise, a poor diet with excessive alcohol intake or caffeine intake. Especially with osteoporosis, calcium is quite important. So if our diet has been low in calcium for several years, then that can increase our risk for osteoporosis, as well as things like having a high salt intake. So, a diet very high in salty foods. Or other things such as smoking, that can be a contributing risk factor as well. Yeah.
Alrighty. And Janet, some people are more at risk of getting osteoporosis because of some medical conditions they have. So could you tell us a bit more about that?
Sure. Well, as Christy's already mentioned, advanced age is certainly something that contributes to the risk factors for osteoporosis. Family history, if you've got a strong family history of osteoporosis in your family, then certainly you need to be very aware of that and taking positive steps to counter that issue within your health. For women, a lack of estrogen, and for men, a lack of testosterone. Now, women tend to start to lose their estrogen levels in the perimenopausal period, and this is the time when you are still menstruating, but you are noticing different signs and symptoms of approaching menopause, and they include some mood swings, hot flushes, fatigue. There's a whole myriad of them that go on, irregular cycles, heavy bleeding, lots of different things that happen in that perimenopausal stage, and that is a clear indication that the estrogen levels are doing what they normally do, and that is decline around that midlife time. Then into the menopause, of course, the estrogen levels bottom out. They definitely have reached their low, and that's where basically they'll stay. So that then, of course, has a direct impact on bone health and bone strength, because estrogen, as Christy has already said, has a protective factor around keeping our bones strong and healthy. Also, people who suffer from things like chronic asthma and are using steroids to keep that under control, unfortunately that has a detrimental effect on our bone health and strength. People who have thyroid overactivity and treatment for that, the same thing can happen. And people also who suffer from digestive disorders such as celiac disease, liver or kidney disorders. So anyone who is on those medications or who is actually suffering from those conditions will find that their risk of developing osteoporosis is greater than someone who isn't.
So Christy, what can we do to prevent osteoporosis?
Well, in terms of diet and nutrition, so the key really is in calcium. So ensuring that there's an adequate calcium intake throughout life. So really from right into infant or childhood, ensuring that children, adolescents, young adults, you get enough calcium and the recommended amount of calcium throughout your whole life. And not only just into adulthood, but obviously as we age as well, calcium intake is really important.
And why is calcium so important? What's the mechanism behind that?
Yeah, well, basically with bone, it actually reforms all the time, so it's always being broken down and then rebuilding itself. So it's kind of like this restructuring process that keeps going on. And calcium is a key nutrient or mineral really to help in forming that reformation of the bone and providing that strength to bone. So calcium is stored, pretty much 99% of it is stored in our bones and teeth. There is a little bit that flows around in the blood, but so therefore, ensuring that we have enough calcium in our diet means that there's more calcium that's been able to be stored and strengthened, help to strengthen our bones and teeth.
So how much calcium do you need in a given day?
Yeah, so the recommendations at the moment, the Australian Dietary Guidelines, for adolescents and older adults is 1,300 milligrams per day, whereas for just general adults being 19 to say 70, it's 1,000 milligrams. So what that really equates to is about 2.5 to 3 serves of calcium per day. So one serve example would be 1 cup of milk or 200 grams of yogurt, or 2 slices of cheese. That's also. But there's also other non-dairy sources of calcium, so such as you can have sardines and canned salmon, where the small bones are edible, so that provides you with some calcium as well.
So it sounds like it's a very achievable thing to get that much calcium. It's not like
it is.
Drink like liters and liters of milk.
Yeah, definitely. It is, and it's not only milk exactly.
Yes,
so
okay.
you can mix it up throughout the day, providing just some milk with breakfast, bit of yogurt at morning tea, and having maybe some salmon or something at lunch or dinner. Yeah.
Okay. Now you've developed this pamphlet on high calcium foods, which looks really interesting. And so do you want to talk a bit about that? And
Sure.
It's on the Women's Health and Family Services website, and soon to be on the Rural Inreach website.
Yeah.
So can you tell us a bit about that and what it has and what information it has in it?
Sure. So basically, this calcium pamphlet here is a information pamphlet about the foods that are high in calcium. Inside, we've aimed to make it very pictorial. So if you can see, you've actually got pictures that represent the different foods or drinks that calcium can be found in. So on this side, you've got the best sources of calcium. So they generally are your dairy products or substitutes. So fortified soy milk or rice milks, tofu, for example. And then you've also got these other good sources here. So like I mentioned, the salmon or sardines, certain nuts, for example, almonds can provide some calcium, but we do recommend that the best, the most easily absorbed and the best sources are from dairy or substituted products.
And then on the back, I think you have an example of a diet for a day.
Yeah, that's right.
So that it sounds like it's a very handy sort of pamphlet, and it talks about how much milligrams of calcium you need and things like that. So I found it really useful. So I'd recommend it to anyone who's out there who wants to kind of explore that a bit more. So Janet, there are also other things that you can do to help prevent osteoporosis besides having a calcium-rich diet. So do you want to talk a bit about that?
Okay, so certainly look at things that you can do around your diet and exercise, but also looking at things you can actively take, such as using hormone replacement therapy to get your estrogen, which is may be depleted because of the perimenopausal, menopausal stages in a woman's life. And certainly using that to help maintain your bone health. Looking at having a bone density test done. That's just a simple test that's done at a radiography clinic. You need a referral from your doctor, and all they do is scan and have a look at the density of your bone, your long bone in your leg. So it's very quick, very easy, and we'll give you, it is recommended actually to do it when you're around in menopausal age to get a baseline, and then repeat that as you wish or as your doctor requires as you advance into older age. Also, medications is a big topic. There are quite a few different medications around. They all do much the same thing except for one, in actually helping to build up that bone, the bone replacement cells in the bones themselves.
So the bone density test doesn't sound too scary or very painful, which is always good. But I've seen them sometimes in chemists or, like at the shops. So it says, scan your bones here. Are they any good, those ones? Or
Not
are
at
they?
all.
Okay, so we should avoid
Not at
those
all,
ones.
no. The
Okay.
definitive data that we need to measure bone density can only be done in a radiological clinic. And I realise for some people in rural or remote areas that could be a bit of an issue, but you can access them, next time you're going to a centre where there is a radiological clinic there, then that's the time, if this is what you're after, to get your referral from your doctor and have it done then. It is something to really consider doing and to be proactive around that.
Okay, and I hear about the role of exercise in all of this. So can you explain a bit about that, Christy? So how does that all work?
Yeah.
Or both of you, perhaps.
Sure. So exercise, in particular weight training or resistance training, as it's called as well, does help to strengthen the bones by encouraging and building up that bone density. So that could be anything, yes, you could go to the gym and do weights, but it could be just simply activities or exercise that uses your body weight as a resistance. So walking, doing body weight exercises like push-ups, for example, or basically anything that has a load. You could use your groceries, for example, as weights. That's a great one at home. I think it's really important. I forgot to mention it earlier, but with exercise, it has a other effect that if you're outside and doing it, you're getting vitamin D from the sunlight. And vitamin D is actually really important with bone health as well. Vitamin D helps our body to absorb and to use the calcium from food. So, you might be getting heaps and heaps of calcium in your diet, but if you're vitamin D deficient, then your body's not at its, it's not most effectively absorbing and using that calcium as well.
Okay, so it sounds like walking outside would be a great exercise.
Yeah, walking, yes.
Yeah. But Janet, you were talking to me previously before this started about Tai Chi and yoga and Pilates. Or dancing even. So what's good about that? You were talking about balance. So what was good for that?
Well, not only are they weight bearing and resistance, but they're also great for keeping your core strength stable and central as well. The dancing you need to do 3 times a week. It's not okay to go to a class once a week. So it's fine to turn the TV on at home and dance around the living room daily if you wish.
Okay, sounds like
a great form of exercise and a good release as well. Yeah.
So it sounds like the balance and the weight bearing are the important key things in the
That's
exercise.
right. The other thing too about the balance also is, as we age, it's always recommended when we get around late 60s into our early 70s to have a falls risk assessment done, and that can be done by a physio, an occupational therapist. Your GP can organise that for you, and that will just help to determine whether you are actually at risk of that happening to you.
And what about calcium tablets? You see them in the supermarket, and what's their role in all of this? I think there's a photo of one brand up there.
Yeah.
So you see them all the time. So what's the story with those?
Okay, so there's been a lot of talk just recently in the media around the risks of cardiac problems when people are taking calcium supplements, but it's not conclusive. So what we advise as health professionals is to take your calcium if you are at risk of osteoporosis, or you are at an osteopenic stage, which is where there's definite results of your bone mass thinning. It is better to treat that than not to. Okay, so that's what we would recommend, and certainly check with your doctor around that as well.
So Christy, is it better to take calcium tablets or to try and get it in your diet?
Oh yes, that famous question. Can I just pop a multivitamin and
Yeah,
I'll be fine?
Can I just take a vitamin, it'll be all better,
Yes, no, as dietitians, we recommend that you get your calcium from food predominantly. As we mentioned before, it is quite easy to space out and get your calcium requirements throughout the day. But we're saying that, as Janet said, for those who do have a high risk for osteoporosis or can't manage to get sufficient calcium throughout the day, then calcium supplements would be recommended and okay to use.
Okay. Yeah. So try first to eat well and then work on it.
I mean, diet is your foundation and calcium's a supplement, so they supplement your diet in that sense.
Sounds good. Okay. Now, what happens when we actually have osteoporosis? What sort of things would you recommend, Janet, from besides just, we've been talking about preventing osteoporosis, so what sort of things can you do once you actually have osteoporosis?
Okay, so basically it's medication. I mean, obviously there's the diet and the exercise, which are really important and essential, but certainly it's medication. There's, as I said before, there are lots of medications available, but the main ones are bisphosphonates, which are taken weekly or monthly. They're tablets. There's also an IV intravenous infusion you can have yearly. That works really well. It increases bone density, okay, so it puts back those bits of bone that are actually not working very well. So there's another one that's an injection, and that's 6 monthly, and that works by slowing down the rate at which the bone is actually broken down. So that's a good one. And I think you really need to be seeing a specialist by this stage if you have diagnosed osteoporosis, because the specialist will then work out which treatment is going to be most effective for you and is going to give you the best result. There's also another one, which is a sachet, which is dissolved in water, and that's a daily medication that you need to take. That sort of works in a similar way to calcium. So it increases bone formation and also reduces bone loss. So you end up with stronger, healthier bones. All this takes time. It's not a speedy process, unfortunately. So the treatment is going to have to be ongoing. Now, the injection that I talked about is a daily injection for 18 months, and this is when everything else is not working. Okay, so basically it's the last form of treatment that would be recommended. So this is when your bone density hasn't improved. And what it does is it stimulates the bone forming cells to actually grow new bone. So it sounds pretty miraculous to me, but it has that limited life of 18 months. Following that time, you would then resume a treatment that probably you would have tried before.
Okay, so can you get Medicare rebates for all of these sorts of medications? Because they do sound quite complex, and especially the one where you have to inject yourself every day.
Look, I mean, people with Medicare and who have identified risk factors for osteoporosis can certainly get some form of rebate, and that includes the bone density test as well. They are expensive, so if you don't have Medicare, then you may find, that people tend not to actually have the test and screenings done because of that factor, and I sympathise and understand that, but unfortunately, in the long run, if your bone density is poor and you end up with a fracture, then you're looking at huge financial and personal, physical, mental, emotional impact on your life. Okay, so the doctors should be able to help you whether you're eligible or not. Some private funds do give a rebate as well, but the risk factors for osteoporosis which will get you a refund include if you're diagnosed with osteoporosis itself, if you've had one or more previous fractures from a minor accident or incident, women who have suffered from early menopause, and that's before 45 years of age, men with very low testosterone levels, people who have the celiac disease or other malabsorptive digestive conditions, the overactive thyroid conditions, rheumatoid arthritis, the liver or kidney diseases. If you're 70 or older, then you certainly qualify for the rebate. Yeah, so it's the list isn't illuminating. It makes sense, but unfortunately, it is what it is right now.
Yeah. And Christy, can you get Medicare rebates for seeing a dietitian such as yourself? Or?
Yeah. Well, like Janice said, it's really up to the GP with regards to Medicare eligibility. If the GP thinks that an individual would benefit from having additional allied health help in managing their osteoporosis or any other chronic disease.
Or preventing it? So if you were preventing it, would they get a Medicare?
No, with Medicare, from my understanding anyway, with allied health, they would have to have the chronic disease already. But again, it's up to the GP about whether or not they'd be eligible to get Medicare sessions with a dietitian.
Right. And Janet, before you were talking about HRT, can you get that through Medicare, or do you have to go see a specialist in a city?
Well, the HRT is really just a script from your GP.
Okay.
And yeah, it's that simple.
Okay, so doesn't sound very complicated. If you have a GP, you can just go and talk to that. Yeah, okay. And that would be mainly covered through, at least some of it would be covered through Medicare?
It would be. It's not cheap, to be honest. But when you think of the benefits that taking HRT can give you as far as osteoporosis and menopausal symptoms are concerned, then perhaps the benefits, I think, in this instance may outweigh the cost. If people are on a healthcare card, they do tend to get their prescriptions at an extremely reduced rate. So there are these things to consider around payment for medication.
And all of this medication and treatment, is it readily available for people in rural areas, or is it a bit harder to come by?
No, the medication is certainly available. However, the research that was done at Royal Perth for 4 years showed that of people who were prescribed medication, rural people were less inclined to continue to take it. And I'm not sure whether that's because of the isolation, the lack of facilities, the having to travel to pick up scripts and things, the cost definitely as well. So, but that certainly has been shown to be something that rural people are less inclined to follow through with treatment if it's recommended for them. So that's certainly something to think about.
So where can people go to discuss their concerns or issues around osteoporosis? Are there some places, Christy, that you could sort of suggest?
Yeah, sure. Well, like we mentioned before, you can go talk to your GP or visit your local health centre for more information. For those accessing the internet, there's also great websites such as Osteoporosis Australia or the Jean Hales Foundation that actually has some information about osteoporosis. Jean Hales actually has a free call number, I think it is. Yeah, so it's on the screen, 1-800-151-441 that anyone can call, as well as the Royal Flying Doctors Service Women's Doctor Clinic. People can have a look at their website and inquire about that from them as well. Yeah, so there is a lot of information out there.
Yeah. And if people wanted to, say, talk to you about their diet and either preventing or now that they have osteoporosis, can they contact you, Christy, through Rural InReach?
Yes, definitely. So if anyone had any concerns about their diet in regards to osteoporosis or wanting to prevent it, I'm available for video conferencing or consultations, and they just have to contact the Rural InReach, and then we can work it from there.
Alrighty. And Janet, you are also available to have a chat to people about medications and just in general about osteoporosis and menopause?
Absolutely. In my other job, in my other hat that I wear, I work in the clinic as a registered nurse midwife, and our clinic at Women's Health and Family Services is for women and their families to access. So feel free to give us a call. We have our 1-800 number on our webpage. The Rural InReach program webpage is there. It's www.ruralinreach.org.au, and our free call number is 1800 998 399.
So it sounds like there is help readily available through the CRCs and the video conferencing to talk to either both of you, or to look at some of those other options of your GP or some of those other organisations that you mentioned before, Christy. Thank you very much for joining us here today at Westlink, and also to the Rural InReach program who are working together with Westlink. And also thank you very much to Christy and Janet for joining us today.
Thanks Sue.
Thank you.
And we look forward to seeing you next time.